Dajahal. Welcome back to my YouTube channel. So the last video we discussed CAMC 1 and I removed my braids. So this is a continuation in the series. Today we'll be talking about CAMC part 2 and I'll go ahead to get my plaits done in order to get my hair done. So it's a whole series on the exams I've done so far: CAMC Part 1, CAMC Part 2, USMLE Step 1, USMLE Step 2, and the OET, which is the Occupational English Test that is used for medical doctors across the world. So let's get into it. CAMC Part 2. Right? I did wash my hair, blow dried it, and it's maintenance day, as I mentioned in my first video. So I'll be basically making plaits and attaching crochet braids to it. That should last for a good while. So when it comes to CAMC Part 2, this one was much easier in terms of studying for the exam itself and the actual exam. So it is 2 days. Day 1 is going to be MCQs, but the tricky thing is that the MCQs is multiple choices, if that makes sense. So you get one question, then you have to, like, let's for example, you get one question, they have A, B, C, D, E, F parts. So it's one question, but a lot of sub questions under that. So that's in regards to day 1. Day 2, it's like clinical scenarios. Because it was 2021, there was still COVID and things going on. So I did mine on Zoom, and I had to still go to UE to do it in the facility. However, I did it via Zoom. So I was placed in a room by myself. I was given a computer, a login, and everything, and it was conducted via Zoom. So how to prepare for the first part, to be honest, it's just daily things that you do when you work. So there is no, how do I put that? There is no set in stone of what exactly will come. You just have to learn clinical topics. I can't remember exactly what most of mine were, but I do remember that I had some questions, like they asked, for example, about pregnancy, and for example, they asked about PCOS. So if they asked about PCOS, they would ask you like a string of questions as it relates to PCOS. So first, you probably have to know the physiology, then the pathology to make the diagnosis, treatment, then can they get pregnant in terms of in vitro. Like, they just basically go down a list of things and make them into new questions. Right, so that's for day 1 of part 2. Day 2 of part 2, I was nervous to start with. I've never really done an exam at UE because I studied in China and I didn't know what to expect. I just went in there, prayed, and trust God that it would turn out well. Thank God it did. So I had some questions, for example, like they give you from different specialties. So I had pediatrics, I had internal medicine, obs and gynae. I think there was one question about COVID related. So those are like, I'm not sure if they have a bank that they come from, but I didn't get a bank for that. As in step 1, I was using a question bank. There was none for step 2. However, I did do again Blossoms classes that helped with step 2 also. And yeah, that's practically it. So in terms of studying, the first time I studied for like 8 months or part 1. For step 2, I barely had time. I studied like for 4 to 5 days. I remember I was on peds and I took, I think, DL, 3 days DL to basically revise before the exam. The day before, I traveled to Kingston. I was already off, so I wasn't as tired as it compared to part 1. So I was off. I traveled to Kingston the day before. I went with a friend. We got an Airbnb. It was really nice. And then the following, so we booked for 3 days, 2 days, 1, 2, 3 days or 2 days. So we booked the day we stayed there, the day one, day two we would leave, which was more convenient. Also, you have to take that into consideration when you're calculating your cost. Now, the cost for step two I paid was $700 US. Yeah, $700 US. So yeah, so step two was way easier, and just your clinical knowledge. If you have ever practiced before, it should become very easy for you. The passing mark is also 50 for part two. So part one is 50, part two is also 50. And as I mentioned, unless you're trying to be, the top star, nobody's gonna know your score. It won't be released to anyone except to you, and a pass is a pass. There's no like, oh, if I get 70 or versus I get 90. Once you get above 50, you pass and you move on to do your license in terms of registering to practice. So before I end this video, things to know, as I mentioned, for step one, you have to pass step one to do step two. You have to have a medical degree to do step one. And, in order to get your medical degree, you have to graduate medical school. I can't remember the exact number of questions that step two has, but as I mentioned, there is also a group that helps with informing KAMC students of when their exams come. And I'll try to drop a link to that WhatsApp group. It's very informative. When it comes to step two, getting a date is very tedious. I remember calling the office like weekly to ask them when will I be able to do my exam. Because for step one, I was able to do it September, and my step two, I actually ended up doing it in March of the following year. So I had to be like, because there's like a wait list when it comes, Lord Jesus, there's like a wait list when it comes to part two of KAMC, which is actually, there's always, from what I know, there's a backlog of people wanting to do the exam, and that was like as a result of COVID and all of that. I'm not sure if that backlog is still going on. I know of at least 2 exams per year, but do remember, if there is a backlog and others are waiting, they're more than likely going to give those others that are waiting on the list first, and then you would have to wait for a while to do step two. In order to do senior house officer year, you would have to pass step one, part one, and part two of KAMC. So I would advise you, as soon as you can, do it in your first locum intern year, because we have that locum intern year where you're not really an intern, you're a locum intern because you studied abroad. You still get paid, but the locum intern year, try to do both your exams so you don't have to pause in order, or extend that locum internship, and you can move on to senior house officer. If you have any question regarding that part, feel free to ask in the comments, or you can reach me on Instagram. I'll link my Instagram account to my YouTube. Thank you for watching. I'm going to go ahead to finish up these slides, and I'll be right back with you for part three. And in part three, we'll be talking about USMLE.